Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another really asked question. Tell me about a patient where their hospital occurs or hospital discharge was complicated by social determinants of health. Initially, after checking this question, I really don't know how to answer it. I don't even know what's the meaning of social determinants of health. So after Google it, I found that the social determinants of health means some conditions in place where people live, learn, work. Some in a word, the environment that they lived caused uh, quality of life risks and the outcomes, something like that. And there are 5 domains of this system. So um, I don't. So for answer this, that's why I don't think too many people will know this and know how to answer it. So if we have no experience of it, we can definitely tell the interviewer that we have no experience of this question. So the interviewer probably will go to the next question. Well, if you happen to know the meaning of the SDOH and you know and you have experience of that, you can definitely talk about that, and you can talk about any of the above 5 domains. And but here you have to share one of the cases you met before, because the interviewer want to know a case here. So you need to you need to give them a specific example. And based on my experience, I'm currently shadowing with my supervisor on his service in cardiology. So I'm happen to saw one of these patients. So so I can definitely share with you my experience here. Okay, so Dr. Cui, can you share me with a patient who is discharged and and who are complicated by the SDOH conditions? So can you share me something of that? Yeah, definitely. I'm currently shadowing with my boss, who is on who is on his service in cardiology department, and we saw a patient who is a 20 years old lady with cardiac arrhythmia, um, without any histories, and her physical examination are normal, and all the lab works are also normal, and she and then and after 2 days stay in the hospital, we decided to discharge her. And she complained that in her college there's a building releasing toxic stuff. So she asked us which department she can report it to this problem, since she and her roommates had already reported to their chancellors. Well, they didn't get any message or any feedback from the chancellors. So she wants to ask our suggestions. Well, in this situation, actually, I happen to know how to do that because my research is on air pollution and cardiovascular diseases. So I just recommend her to report it to their environmental health and safety department first, to see if the people can help her. If they can, if they cannot do anything about that, she can definitely ask some advice from those people. And if she still want to uh, uh, report it to the government, she can definitely uh, report it to the public health department, and let the people in the government to get involved in this issue. So actually, that's my answer. So the, so the case, you have to know the meaning of the SDOH, and you happen to saw a patient, or you have seen a patient of this problem, then you have something to talk about. If you really don't know how to answer this question, just let the interviewer know that you don't have any for this kind of experience. So that's it. Hope it's helpful.